analytical team. I have most of the PASRR team with us today. We're going to go over the basics of PASRR, the systems, so the level of access that you all have. We'll answer any questions you have, and we'll also go over the web page just to refresh everybody on where the training material is. So I'll hand things over to the team, and we'll get started.
Okay, thank you, Thomas. So hello, everyone. I'm Kathleen, and I will go over some of the room expectation. So as you enter the training, you will be automatically muted. After the demo, if you have any questions, please type them in the chat and make sure to select everyone or all panelists so we can see your questions. We'll address them during the Q&A session. And any questions that are not addressed during the presentation Q&A session will be added in the FAQ or can be sent to the PASRR inbox. The purpose of this training is to make sure all MCP users have access to the system, understand the PASRR process, and know how to use the system features that support the timely completion and review of the PASRR submissions. In this training, we'll start with a PASRR process overview. We'll go over the PASRR system demo and the PASRR web page demo, and then we'll end with a Q&A session. And I'll go over the PASRR overview. Common acronym. We use acronyms to identify programs and entities. Here are some of the common acronyms we'll be mentioning in the training today. CP stands for Consultants Psychologists. They are in charge of the PASRR determinations. DDS stands for Department of Developmental Services. They oversee the IDDDRC process. DSCS is us, the Department of Healthcare Services. EHD means Exempt Hospital Discharge. This is the only exemption from the PASRR process. GAT refers to General Acute Care Hospital. IDDDRC stands for Intellectual Disability, Developmental Disability, or Related Conditions. PASRR stands for Pre-Admission Screening, PASS, and Resident Review, RR. SMI means Serious Mental Illness, and XNF refers to Skilled Nursing Facility. Here we have the definition for some commonly used terms. A new admission is an individual who has never been admitted to the facility before or does not qualify as a readmission. A readmission is when an individual who is already admitted to the SNF leaves temporarily to the hospital for care and then returns to the SNF to continue their care. An interfacility transfer is when an individual transfers directly from one skilled nursing facility to another with or without an intervening hospital stay and without being fully discharged to home. Here we have the definition for significant change of condition. It is any major decline or improvement in a resident's health status, and a resident review or RR needs to be done for any significant change of condition as a status update. And these three criteria for significant change. So first, it will not normally resolve without intervention by staff or through standard disease-related clinical care. In other words, the change is not considered self-limiting. It affects more than one area of the resident's health status, and it requires an interdisciplinary review or revision of the care plan. Exam hospital discharge. The 30-day exam hospital discharge, or EHD, is an exemption from the PASRR process. All of these three criteria must be met for the hospital to use the exemption. First, the individual is admitted or plans to be admitted to the SNF directly from a hospital. The individual requires SNF services for the same condition treated at the hospital. There is an attending physician certification that the individual likely to require no more than 30 days of SNF services. This certification can be a note, a letter, or an email, etc., as long as the document can be produced upon request in the future. We recommend keeping the certification in the patient's medical records. Serious mental illness, or SMI, refers to a diagnosed or suspected mental disorder that results in either functional limitations in daily life within the past 6 months or requires recent treatment within the past 2 years. We have a full definition of SMI on our webpage. This is the definition of the IDDRC, which refers to lifelong conditions that start before an individual reaches adulthood and affect how a person thinks, learns, or functions in daily life and may require specialized services. A full definition, including examples of related conditions, is shown on this slide. And now I'll hand things over to Camille, so we'll continue with the PASRR overview.
Thank you, Kathleen. And then before I begin, I know we said we were going to hold off with questions, but we definitely want to pause anytime you guys do have a question that come up. So Daphne, you had a hand raised. Did you want to ask your question?
Sure. This is Dr. Lowe. I also put
Dr. Lowe, sorry.
I put my question into the chat as well. We're really trying to ensure that we're following the expectations of DHCS and really trying to understand what is the expectation and how might we follow and stay true to the purpose and the process of resident reviews, particularly around the changes in condition, as this, depending on the expectation, this may represent something quite new to our facilities.
Okay. And Thomas, did you want to go ahead and address some of these questions that Dr. Lowe
Yes.
had? Okay.
Sorry, I was talking on mute this whole time. So for the RR, and when the facility is supposed to do it and how you guys are supposed to review it, it depends. And I'll get into this in more detail after we get through the slides, because this is a subject that we've been mulling over the last couple of months. In a nutshell, the facilities, specifically the SNFs, are supposed to be submitting a resident review for any significant change as soon as they identify that change. So the best example of that we have is usually someone needs to go to the hospital for care. And when they return, the SNF is supposed to identify any significant change upon return. And as soon as they identify significant change, they submit a resident review to update the PASRR. And then that way, the PASSR process can do another once over to see if there's any additional specialized services that can be identified for the individual as a result of that significant change. Um, so it's not always guaranteed that the resident review is needed. Like I said, it all depends on that significant change. When the SNF sends a person out, usually, again, this is for hospital visits. When they send that person out, sometimes they already know when the person's going out that it's because of a significant change and that they're going to need to do a PASSR when they return. If they don't know, again, they're taking a look at all the documents they have when they return, and they're determining if they need to do a resident review for a significant change. And the guideline we tell the facilities for significant change, one, we have the FAQ on our webpage, which we're going to expand on. So I'll talk about that later. But we always tell the facilities, look at the PASSR you guys have on hand. If you would answer the questions any differently, go ahead and submit that resident review just to make sure that they're covering all the bases. And just because they submit a resident review significant change doesn't guarantee that a level 2 is needed, meaning an evaluation. So just going over that a little bit, that's basically how it works for the facilities. Does that kind of sort of answer the question for now? Because like I said, I do want to go into this in more detail a little bit later.
Sure, it sort of does. It
Yeah,
seems then that the facilities are being instructed to refer to their prior passer to determine sort of if there is a change in a condition that would affect the passer versus, um, say, if a resident leaves and there's a bed hold and they return, they leave to go to the hospital, return anticipated, they come back, and on their readmission or return rather to the nursing facility, um, if there is a significant change in the member's condition that would prompt essentially a new IDT and or MDS out of the set quarterly and annual review cadence, that separated then from the PASSR?
technically, yeah, because
Got it.
PASSRs aren't required in any specific timeline. Basically, it's as needed. So some facilities can have PASSRs that are done, and they technically never need to do an RR. They never need to do any update ever. As long as that person hasn't been discharged to the community, that PASSR is legit. As long as, like I said, they wouldn't change the answers for the PASSR. Um, and like I said, we can get into the details on significant change in a little bit because the definition we have is very vague just because we didn't want to confuse anybody, specifically in 2023 when onboarding hospitals. But the definition that CMS has is a little bit more specific, and we can go over that in a little bit.
Yeah,
um,
and I think, again, we're just trying to really make sure we're following the process and
yeah,
following what DHCS is instructing managed care plans to do, understanding that there may be significant impacts if the process is not followed for on the state and the federal level.
right,
So and this is where we're really trying to understand the definitions and the differences because it seemed that DHCS was using the CMS RAI definition for change in condition. So we're really trying to understand to what degree we need to monitor and oversee, uphold the processes, whether it's the CMS change in condition and then the requisite, if there is a change in condition, there's supposed to be a new IDT and a new MDS, and what connection that may have to the PASSR process.
right, yeah. Okay. Yeah, so let's get through the slides real quick and then we'll circle back to this because like I said, I know that's going to be the majority of our training today is probably going over that.
Sounds good. Thank you.
Yep.
Thank you. Okay, so I'm going to continue with the middle part of the training. So PASSR process, PASSR purpose is to ensure anyone with a qualifying SMI IDDDRC will be evaluated to determine if services and support specific to those conditions that are over and above what the SNF would be expected to provide as part of their per diem. PASRR screening requirements. PASRR is required by law. Code of Federal Regulations, Title 42, Section 483, point 100 through 138, for anyone going into a Medicaid certified SNF, regardless of the individual's insurance type or payment source. Please note, for non-Medicaid certified SNF, the PASRR process is not needed for admission into their facility. So PASRR responsibilities, PASS. PASS stands for pre-admission screening, and this is the initial screening that is done mostly at the hospital when an individual is discharged into a SNF. However, a SNF may need to do a PASS if they are admitted from the community or out of state, and these cases need to be closed before the SNF can admit. So PASRR responsibilities, RR. So as stated before, RR stands for resident review, and this is more like a status update. Hospitals only deals with the PASRR for individuals coming in from the community, going to the SNF. They are not required to submit an RR. That is only for the skilled nursing facilities. The RR is done at the SNF when a significant change of condition has been identified. Okay, PASRR responsibility, interfacility transfer, readmissions. Hospitals are not required to submit a PASRR for readmissions. So if the individual is at the SNF, goes to the hospital, and then returns to the SNF, it is the SNF's responsibility to do a screening if they have identified a significant change in condition. If an individual is transferred from one SNF to another, this is not considered a new admission, and a new PASRR is not required. So the PASRR SMI process. The SMI process is one of two parallel processes in the PASRR system. The process begins with the level 1 screening, which is divided into 3 parts. The facility is responsible for submitting the level 1 screening. The contractor, whose name is Accentra, takes over to conduct the evaluation. And then finally, the Department of Healthcare Services, DHCS, makes the determination. And at any point in the process, if the result is negative, the PASRR process is complete and the case is closed. So the IDDD-RC process. This process starts the same as the SMI process. If any questions in section 2 of the screening is marked yes, then the IDDD-RC process begins when the screening is submitted. If at any point the result is negative, then the IDDD-RC process is complete. Unlike the SMI process, DDS decides if an IDDD-RC level 2 evaluation is needed. If a level 2 evaluation is needed, then the regional center conducts the evaluation, and the PASRR summary will be provided as a form in the PASRR online system. And if they are unable to see the summary report, they can reach out to DDS. And then we will also provide that contact information when we demo the webpage. So I'm going to go ahead and pass it over to Thomas to finish up the rest of the training.
So the level 1 screening is submitted online in our system. They go to portal.dhcs.ca.gov. The hospitals log in there, the SNFs log in there, our contractor logs in there. Everybody logs in there to participate in the PASRR process. The hospitals do the pre-admission screening, as mentioned before. The SNFs do the RR, and in rare cases, they can do the PASRR for community admissions or out-of-state admissions. And the screening that they submit is based on medical records, and we recommend that they have firsthand observation of the individual as well. So we can move on to the next slide here. So when submitting the screening, there might be a few reasons why the SNF needs to update the PASRR. So this is the RR. One could be inaccurate information on the level one, so the hospital maybe omitted some information or forgot to put something. As mentioned before, a significant change in condition, so that's a need for a resident review. If the person was admitted to the SNF on an EHD and they've exceeded that 30-day exemption, then they need to submit a resident review to start the process over, because that exemption basically skips the entire PASR process, and the RR would have the individual go through the PASR process to try and identify any specialized services. If there was an invalid resolution, so let's say the hospital did the PASR, it didn't close correctly, but they were discharged to the SNF anyway, the SNF would need to submit a resident review to get the proper resolution, to get the right conclusion for the PASR process. And then occasionally we have system errors where the PASR didn't go through correctly and it's stuck, and submitting another screening for the hospital, that'd be a pass, or for the SNF, that'd be an RR, would help rectify that situation. So for the level 2 evaluation, and keep in mind for the PASR process, anything that stops with the level 1 screening, so any case that closes right away, we consider that level 1. Anything that goes past that initial screening, so there's more work that needs to be done, we call that level 2. So that's why we call it the level 2 evaluation. For the SMI side, it is required by law, by federal regulation, that it is a neutral third party. So our contractor right now is Essentra. So they're the ones that handle all the level 2 PASRs. They do the evaluations, they collect information, they go into the PASR system and submit that information. And that's where our clinical psychologists gather that information and produce the determination. For the IDDRC side, again, required by law, it's a third party. So DDS works with the regional centers. They're contracted with the regional centers to get the IDDRC level 2s done. The evaluations can be done face-to-face or via telehealth. With this contract, we're doing more evaluations via telehealth because most facilities prefer that instead of setting up the face-to-face evaluations. For the determination for DHCS for the SMI side, it is called the PASR determination, and it's available in the system as soon as the case closes. On the determination, we identify the recommended level of care, and we also identify the recommended specialized services. Now, for California, the level of care is important because of how the Medicaid certified SNFs are reimbursed. So it's important for the determination's level of care to match the actual bed type that the person is being admitted to. We do instruct the skilled nursing facilities to check for this. If it doesn't match, then we ask them to either submit a reconsideration, which does not guarantee that the determination can be adjusted, or they can submit a resident review to try and get that level of care to match where they're actually going. And if things just don't match up, so let's say our clinical psychologists truly believe that the person is not best suited for the bed type that they're currently at, then we ask for the SNF to transfer the person to another location that matches the recommendations by DHCS. For DDS, it is the PASR summary report. So that is the IDDRC determination. So once the regional center is done with their level 2 evaluation, they send it over to DDS, and then DDS staff upload that document into the PASR system for the case. So once the case is closed, once everything is done, you guys should be able to find the summary report and determination under the same case. DDS does take a little bit longer to get that done just because the regional centers have a different process depending on what regional center they're working with. But all documents can be found under the case in the system, and I'll show you guys how to look for that in a bit. So there are valid resolutions, as mentioned before, and invalid resolutions. The valid resolutions mean that the PASR process is complete and the person is okay to be admitted to the Medicaid certified SNF. Again, if there's a determination, the only thing the SNF has to make sure matches up is the level of care, just because of how they're reimbursed by the TAR field office. Other than that, if it's the exempt hospital discharge, the SNF knows that the 30-day time starts from the day of admission to their facility. If they know, based off of their observation, that the person's going to need to stay there longer, they can go ahead and submit the resident review within that 30-day window. They don't have to wait for the 30-day window to be up. Once that 30-day window is up, the skilled nursing facility needs to submit the RR to restart the PASR process. Now, our TAR offices give the SNFs an additional 10 days after that 30-day window to get the PASSR closed. So the way it works for how they reimbursed is they have the 30-day exemption. If they get the PASSR closed within that additional 10 days, then the field office does not look at the amount of time to get the PASSR closed as a delay. They'll go ahead and reimburse them. But if the skilled nursing facility does not get that resident review closed within the 10 days, so let's say it takes them another week or two to get the RR submitted, then they will factor in that gap from the 30-day exemption to the close date of the resident review. So that's how they handle it. I'm not sure how you guys are instructed to handle it, but I do like to give the MCPs that instruction just so they know how the TAR office handles the TARs for the skilled nursing facilities. The categoricals, level 1 categorical just means that the categorical condition or situation was identified on the level 1 screening. The level 2 categorical means that the categorical situation or condition was not identified on the level 1. It was identified by Accentra when they did their level 2 screening to see if the person needed an evaluation. The categorical, as mentioned before, is just saying that the person has a condition or situation that would prevent them from benefiting from specialized services. And as a result of that, we're not going to put them through the entire PASSR process because it's basically a waste of their time. Next is the level 2 attempt, no SMI. This is basically saying that the level 1 screening triggered as positive for possible serious mental illness. However, when Accentra took a look and screened the case to see if the evaluation was necessary, they deemed that the person had no serious mental illness or the evaluation was not necessary. And that's when that is closed. Now, we just had an update to our level 1 screening recently to cut down on this situation. So there should be a lot less no SMI cases generated, and our data shows that. But that is what an attempt no SMI is. A positive screening, but when they tried to do the evaluation, they determined that it wasn't necessary and they closed the case. The level 2 not required is pretty straightforward. That means that the logic on the level 1 screening identified no serious mental illness, and it closes the case. Now, level 2 not required does not mean that DDS does not have a positive for IDDDRC. So it is possible that DDS can still upload something, as mentioned before, if one of the questions in section 2 triggers that process. And then the reconsideration complete, like I said before, if a facility has a determination the level of care does not match the bed type that they're going to at the SNF, the facilities do have the ability to submit a reconsideration in our system. And it's basically a request where they can identify what they want changed. So either specialized services or the level of care. 99% of our reconsiderations are for level of care just because of how California reimburses the facilities. But there is no guarantee that the clinician who is reviewing the reconsideration will agree with the level of care change. But that is an option for the facilities. All right, next slide. Okay, so we can get into the demo real quick because we did give you all access to the system. And the whole reason why we started doing the trainings with the MCPs and getting them in the system is that in a perfect world, it should allow you all to review the documents needed. Just in case there's a hiccup getting them from the facilities, you guys can go into the system directly and get the documents you need. So the process is you go to portal.dhcs.ca.gov, you log in, your email password, your two-step verification, whether you're using the Microsoft Authenticator app or you're getting a text message to your cell phone or a phone call. Once you jump through those hoops, it'll take you to this page, the My Apps page. You're going to see PASSR production, but for our training purpose, we're going to go into our staging account, so there's no PHI. Once you get in here, and it might take a second to load, usually you'll see a banner pop up. Since I've already logged in, I don't think it'll come. Yeah, it's not going to pop up here. The banner has important information. Once a month, the PASSR system goes through system maintenance. So starting Saturday morning, 12:01 a.m. until Sunday, 6 p.m., the system will intermittently be down. It's not down for the entire time. If you all have staff working on the weekends, what they might see is the system might be down for like 15, 30 minutes, but after that, it'll be back up. And if it happens again, for another 15 or 30 minutes, they might experience the system being down. So it's not down the whole time. but basically IT is doing maintenance. We discovered after getting the hospitals in, because as you can imagine, that's a lot more staff in the system, a lot more PASRs in the system. To keep things running smoothly, it was a good idea for us to do system reboots or server reboots once a month, just to keep things moving. So that happens. If there's any other issues that we've identified, we'll let you know on the banner. We'll also send out an email depending on how extreme it is. And if there are any updates, so we're constantly updating the system, adding features based on requests from facilities. Anytime we have a new feature being uploaded to the system has to go down for about an hour for that to take place. And it happens Monday through Wednesday. We'll pick one of those days, just in case that upload doesn't go through correctly. That gives us a little bit of time to correct it, so we're not going into the weekend with a broken system. Any updates like that, we send you an email, and we also put it on the banner. So when you log in, it's a good idea just to scan the banner, see what information we have for you, and then you can go ahead and move on with what you're going to do. So this is what you all should see when you log in. Your profile is in the right-hand corner. You guys all have the MCP role. You can view your profile if need be. And this is the plan that you're enrolled in. So whatever name you see here, it should be your plan. If it's not, let us know. We can get you logged in the correct one. The only thing we give you access to is the level 1 case list, because that's where all the cases are for PASR. So if you go to level 1 case list, and you can go to it via the drop down or the quick link here, it gives you a blank list because we don't want to give you everything right away. What you can search for is the individual's last name, first name, or date of birth. If you have the PASRR CID, that's the most accurate way of getting the case you're looking for. So let's search my first name, because there should be plenty of cases in here with my name. As you can see, if you put in the first name, you'll get all the cases with that first name in the name. If you do the last name, it'll do the same. We recommend searching the list for either just the last name or just the first name, because it's a lot easier to find the case you're looking for. Keep in mind, all the PASRs that are entered in our system, someone's manually inputting that information. So as you can imagine, if they input the name and they spell it wrong, and you search the correct spelling, you might not find the case you're looking for. That's why I said searching the CID, if you have it, gives you the exact case you're looking for. So if I reset the search field, put in the CID number, I get that case and that case only. Now, if you don't have the CID and you're searching the name, we recommend searching either part of the last name and part of the first name, because that should give you a smaller number of cases to look for, and it should alleviate the typo situation. Or you can search just the last name or just the first name, depending on how common their last name or first name are. Date of birth isn't always an accurate search criteria, because from what we've seen, dates of births are one of the highest things that have typos in them. Either the day's off by a day or the month is off by a month. So I don't recommend using date of birth as a search field. But this is the case. As you can see, we have all the information needed, what facility the case is currently with, the facility type, the county, the level 1 submit date, the close date, if it was positive for IDDDRC, if it was a pass or an RR, if it's closed, and the resolution. So like I said, the resolution lets you know if the case was closed correctly. And then over here, we have case notes. So if you all want to see the interaction with the contractor, they document all their steps when they first reach out to the facility, when they make second, third contact, when they've received medical records, when they've spoken with somebody at the facility to schedule the evaluation. They put notes in when they've completed the evaluation. They try and document every step they can in the process. Now, this is staging, so there's no notes here, but this is where you would find the notes. And this is a read-only window, so you guys won't be able to input any notes. But like I said, you can see the transactions here. Next, we have the letters. So any letter that's generated for the case will populate here. The level 1 case list is a PDF. You all can view that. And you can take a look at the marks that were put here. And then the letter that's generated after depends on how the screening was filled out. So for the level 2 not required, the only letter that's generated is a notice of no need. And that letter basically explains that there's no need for any further action the SMI wasn't triggered and the SMI process is done. Now, like I said, the level 2 process for IDDRC can still be positive, and when DDS is done, they will upload their letter to this column as well. If you're ever missing this letter, you can always tell the facility to reach out to DDS and request it. Sometimes the regional centers take a little longer than expected, and DDS will reach out to the regional center and request them to hurry up and get that letter uploaded to the case. But this is the best way to look for the cases. CID number, if you don't have that, search for their name, and then scan all the way to the right, check out the resolution, and then go here to check out any documents. You can also check out the case history. If you want to see what happened, you can see who at the facility submitted the case. If there are any updates made to the case, it'd be a new line item. And also, when the case is sent from one facility to another, because we have a system feature called the file exchange, where the hospital submits the PASRR, once it's closed and they have a SNF lined up that they're ready to discharge the individual to, they submit the file exchange in our system. So they pick the facility they want to send it to. They send it over there. Now, once they send it, the receiving facility has to accept it. Once they accept it, then the transaction happens, and then that will be identified here on the case history. So you guys will see a line item for a file exchange, and you can see what facility it came from, what facility it went to, who accepted it, and all those details. So that's the overview of the level 1 case list. Are there any questions about this right here? And you guys can just unmute if you have any questions about this part. Nothing? Okay.
I have a question.
Oh, sure.
And I apologize if maybe I just didn't catch it. So I know in previous trainings you said that if that each facility only has access to the PASRRs unless it's been transferred. So
Yes.
are we as the health plan going to be able to see all of them that are listed? Will we have access to all of them?
You all are semi all powerful. So for our roles, we can see everything. And we didn't want to overwhelm you all with all the cases in the system because it can be very overwhelming. So what we did is you technically have access to all the cases from every facility. The only limitation is that you have to search the CID number, last name, or first name in order to pull up cases. So yeah, you have access to all of them.
Okay, and then I know you had said a couple times that other health, you guys have provided this training to other health plans. So do other health plans, do you know if they utilize this or do they rely on the facilities for turning in everything?
So I know that the facilities are supposed to turn in everything. My understanding is that the other health plans do use this, the ones that we've done trainings with. And I think we have about 6 or 7 that we've done trainings with. Of that number, only one says they don't use it at all, even though they have access. Everybody else says they do use it. My understanding is if there's any delay in getting the documents they need from the facility, then they can just go in here and get it. But they are supposed to, well, the facilities are supposed to be sending everything to you guys.
Okay, and then I guess one other question about this. So if, so since other health plans are utilizing this, do they just have one representative with a login for the PASRR portal, or do all of their staff? Because like I have 4 nurses that are under LTC, and I know I want to say that our inpatient team has at least 5 of the skilled nurses, and I'm not sure about A&G. I think they have 2. So would each one of them need to have access, or would we just have one person, whoever already has been given access?
So that's up to you guys. I can say that other plans have multiple staff who are enrolled in the system.
Okay.
But it all depends on who you all want to actively be using it, on a day-to-day basis.
Okay. And if we want to have multiple people, would we just reach out to you all for granting them access?
Yeah. If you all want to add anyone else that wasn't already added, yeah, just reach out to us and we can give you the contact information for the PASRR inbox. Just reach out to us and then we'll get you enrolled. So I'll show you where the form is. You guys can just fill out the form and then and yeah, we'll get those staff enrolled for you.
Okay. Thank you.
Yep.
Yes, thanks for asking that, Alex. This is Carla, my inpatient team. I think a couple of them would definitely benefit from having access. I was just able to access myself, and I see that there's a unique code to log in. So I think this will be really useful for them to follow up on what levels have been completed and if they have any documents they're waiting on from the facility they're reviewing for. So I'll
Yeah,
send the names to whichever email address is best. So thank you.
no problem. Yeah, that was the idea. We heard that there's a little bit of hiccups for you guys, so we said let's give you guys access directly to the source and hopefully speed things up. All right. We can always come back to this if you want, but we can continue on with the slides, Kathleen. All right, so for contact information, the email address that we have here, and it's also on our webpage, so don't worry if you don't if you can't jot it down right now. PASSR@dhcs.ca.gov. That is the main PASSR inbox. Now for the MCPs, we don't have a dedicated process for getting staff enrolled, so this is the best way to do it. Just email us with that form, let us know you want to add some staff, and we can get you guys in there. Normally, what the facilities do is they fill out that form and they email a specific inbox for getting staff added for as an approver. But like I said, you guys are special because you guys have a special role, and we don't want anybody delayed with getting their staff in, but we specifically want to make sure that the MCPs have everybody in there that they need. So this is the most direct way to reach out for us for that. We work Monday through Friday from about 7:30 to 5:30-ish. Not really 5:30, let's say 5 o'clock. But as long as you get us that email, we should be able to get your staff active within 24 hours. Now, the earlier you get it in the day, the quicker we can get them in. So, if you send it in at about 4 o'clock, we might not be able to get the staff in depending on what we're doing. But within 24 hours, we'll get staff in there. Okay, so the Q&A. So like I said, I know that the significant change is a big part. So what I'm going to do is I'm going to put the verbiage that we're going to put on our webpage up on the screen so you all can see it. Um, this is like an expanded version of the significant change definition. And what it what the difference is the definition we have on the page right now, and I'm getting it together, so just give me 1 second. The definition we have on the page right now is really vague. Um, and this new definition kind of focuses on who actually needs to submit a resident review. So the key thing here, and I'll zoom in a little bit so you all can see, is the RR is only required if a resident has a suspected or diagnosed serious mental illness or an intellectual disability, developmental disability, or related condition, and has experienced a significant change. So before the definition we had only talked about significant change. It didn't say specifically for those who have a diagnosed, suspected SMI or IDDRC. So that's the big difference. Um, and that should require a lot less facilities to need to submit a resident review. In the past, the definition we had was a lot more broad because, again, we didn't want confusion, but this is closer to the true definition. Dr. Lowe, did you have any questions, or did you guys want to talk on this a little bit more?
Yeah, that would be really helpful. Thank you so much for showing this to us. I think this does help create some clarity, particularly as it pertains to severe mental illness or IDDRC. I agree that that is going to help our facilities, I think, because there's always that challenge for members who are very medically ill, particularly those who may carry a diagnosis of dementia or neurocognitive impairment, and we expect ongoing progressive decline, at what point would we require a new resident review with kind of expected decline? So I think this is helpful. It would be helpful for us to understand from DHCS's perspective what are the impacts, if any, outside of the most important thing is we want our members to get the care that they need. And if there is a significant change in their mental health, or disability and related condition status, we want them to get the care that they need for those conditions. In addition to that, what might be the impacts on perhaps more operational state or federal level if, say, there is not a resident review performed when the status of a severe mental illness changes?
That's a good question. The biggest issue, so generally speaking, the federal government doesn't step in unless they see a trend and the issues are running rampant, so to speak. The direct impact, though, is usually the payment for the facility. So, like I said, the TAR office, they're taking a look at the same documents you all are looking at. They're looking at timeliness of everything. They're making sure that things add up. They're flowing in the right direction. If they identify that a significant change took place and the facility did not submit the resident review on time, and the facility is requesting payment for a certain time frame, then the TAR office takes the delay into account and they won't reimburse the facility for that amount of time that they didn't, timely submit that resident review. So that's the direct impact. Um, like I said, the federal government doesn't step in unless things are like really bad. And when that happens, we have to send data and then we all kind of sit together and take a look and see what needs to be done and what will happen from there. So we haven't had that happen really from the federal level. The only federal not interference, the only federal participation we had is when California was not pre-admission compliant, and we worked with the federal government since before I joined PASR in 2018 to become pre-admission compliant. Other than that, the federal government hasn't been too involved. Um, just so you guys know, we do have meetings with CMS at least once a quarter, just giving them updates on how California's doing. And again, unless something's really out of whack, then they're fine with the annual report that we send. And just a heads up as well, we do send them an annual report on numbers, and they can take a look at that. And if they have any questions, we can dive deeper. But so far, with all the reports we've sent, they haven't had any additional questions. So yeah, impact is directly from California with that TAR office and making sure that the facilities are doing things in a timely manner.
That's really helpful to know. What does the TAR office, because we do want to align as much as possible, some of the feedback we do get from our facilities is that it's very frustrating when different entities request and review potentially different things.
Yeah.
So we do want to align with the TAR office as much as possible. What does the TAR office review in terms of determining if a member did or did not have a change in condition that required a resident review?
That is an excellent question. Because I know, so the TAR office looks at documentation that the PASR team doesn't have access to. They are looking at medical records. So if they see anything in there that would lead them to believe that a significant change took place and the PASR wasn't done, that's kind of that's where the decision's made. So I don't know what they see exactly, but I do know they see additional documentation that's not in the PASR system submitted by the facility.
Is there any way we might be able to get a little bit more specific information, or potentially get some sort of a process map, or anything from the TAR office so that we might align?
Yeah, I can definitely reach out to management over there, and then we can get something over to you guys. I don't know how soon we can get it to you, but yes, we definitely can get something to you.
That's fair. I mean, our goal is really, we want to make sure we're following the expectations and the processes of the state, as
Yeah.
well as trying to ensure that we're aligned as much as possible so that our facilities aren't trying to do different things for different people.
Yes.
And for us, I mean, what we know, and what we do try to utilize are the processes and the documentation required of nursing facilities to as part of the regulatory expectations. So things like IDT notes, MDSs, are things that we've been trying to utilize as much as possible. And so we do want to understand and align as much as we can with the state TAR office as well.
Yeah, that makes sense. I agree. So yeah, I will work with my contacts over there, and we'll see how quickly we can get something over to you. But yeah, I'm completely on board with that.
Thank you.
Are there any other questions? And if you guys want, we can also I wasn't able to get one of our clinical psychologists on this morning. But if you have any clinical questions as far as the PASR process goes, we can always set up another meeting with one of our psychologists if that interests you guys at all. No need if you don't have any interest.
I think I certainly there is a clinical interest, particularly around the connection and coordination between mental health services and the medical services, and knowing that there are a lot of and ample opportunities within the older adult population and nursing facility long-term care population to create stronger bonds there.
Yeah. So is there anything else you all would like to cover? Because that's basically it. And like I said, you guys are getting a sneak peek at the new definition for significant change. We're going to get it up on our webpage pretty soon, probably tomorrow. We have a new process for getting things uploaded on our webpage, so we're going to test it out tomorrow and see how smooth it is. Fingers crossed that it gets up there tomorrow. But as soon as it's live, we will send you guys a link, even though you have the text right now, just so you all are familiar where it is. Oh yeah, I can go over the webpage because that has a ton of training material. So give me 1 second. Okay. So well, we can put the link to the webpage here, but if you don't have the link and you just go to dhcs.ca.gov/PASRR for PASR, it should take you here. We have a newsletter that we haven't updated in a while. We should be putting something up here soon because a lot of things have been moving in the background for PASR. The MCP requirements, now we've had this up since before May 1st, 2023. So the facilities were aware that this was a requirement. And in all of our trainings that we've done with the hospitals and SNFs, we let them know that this was a requirement. And we still remind them to this day in our trainings that this is a requirement. So this has been up here on the page since before May 1st, 2023. We have general information about PASR. If you guys ever want to look at the regs, you can copy the number here. Just put it in Google and it'll take you to the federal regs. In all of our trainings, we go over the level 1, level 2, and determination in more detail, but we have a quick overview of it here. We have contact information. So the facilities are instructed if they have questions to reach out to us via IT service desk. Service desk is kind of like a call center, and they're familiar with the PASR process. They'll answer any questions that they can, but if they can't, what they'll do is they'll create a ticket and they'll send it directly to our team. And then one of our team members will reach out and assist. Tickets can be sent at any time, but the team will only respond from a similar time frame, about 7:30 to 5:30 for service desk. They're state staff as well, so they only work during the weekdays, no weekends, no state holidays. We do have an on-call schedule for the facility, so if there's an emergency, um, I think it was last year, there were a couple of sister facilities. They lost internet, they lost phone, and they needed assistance getting their PASRs done. So we worked with them to figure out a process to keep them moving, and they were successful until their systems were back up. But anything after hours, if the facilities have an emergency, they can call one of the numbers on the schedule, and that's PASR management, and we'll get in contact with them and figure out what needs to be done. If they need to reach out to a Centra, their phone, fax, and email are here. We always tell them that they should reach out via phone and email just to make sure that a Centra has plenty of ways to get back in contact with them. Um, for the TAR office, this is a general number for the skilled nursing facilities on how to submit their TARs, but for any detailed TAR situations, we tell them to reach out to IT service desk, give us the TAR number, and then we work with them on basically figuring out situations. So sometimes, like I mentioned, when they send that invoice to the TAR office might say they need additional documentation. And then the SNF, if they're not clear on what they need, they can submit a ticket to IT service desk, and we'll work with them on what exactly they need to make the TAR office happy. For DDS, we give them their phone and fax here. Again, if that IDDD letter or summary report is missing or a little bit late, we tell the facilities they can reach out to DDS directly to see if they can get that moving a little quicker. And that is manually uploaded by DDS. So once it is ready, DDS staff can upload it directly to the level 1 case list here under the letters icon. And then we have the reconsideration process that I mentioned before. That's all done in the system. And like I said, the clinician does have the ability to stick with the original result that they have. They can say they don't want to change anything. If the person who's submitting the reconsideration is not happy with that and they still want someone to take another look, they can request a state fair hearing with the California Department of Social Services. I've only seen that happen 1 or 2 times in my time with DHCS, but that is the final um, request that they can submit. After that, everything's said and done for the case. They can't do anything else. To enroll staff, this is the approver form that I mentioned before. If you click on it, it's a PDF. You can download it. Why is this in the way? There we go. Just download it. It's made for the facilities, but you guys can use it if you want to add more staff on here. Just tell us the name of your managed care plan, and for the facility type, just put MCP in the other field, and then we know exactly what to do with your form. It says send it to PASR IT, but like I said, if you send it to passr@dhcs.ca.gov, we'll probably get to it a little bit quicker because all the other facilities requests are going to PASR IT, and it might not get seen right away. It'll still get done in 24 hours, but if you send it directly to passr@dhcs.ca.gov, it'll probably get done a little bit quicker. Instructions on how to fill out the form are here. And then once you guys have your staff in the system, you should be good to go. There are 2 roles in the system that the facilities have. It's an approver, that's like their admin, and then they have the user role. We do give them instructions on how those 2 function down here, but like I said, you guys don't have to worry about that because you have special roles in the system. Scrolling down a tad, this is the login page that you want to bookmark right here, portal.dhcs.ca.gov. If you all bookmark anything after this, there's a good chance the system's not going to accurately track when you log in. As a result, we send all of our correspondence to an active user list. And since you all are newer to the system, it won't affect you right now, but let's say a year down the road, if you bookmark anything after this, then that initial time you log into the system will be the last login date that you have, unless you bookmark this page. So what happens is certain staff log in for the first time, they bookmark the PASR app itself, and every time they log in, it's not tracked. So to us, it looks like Sharon from Kaiser has only logged in 1 time last year, even though she uses the system every day. So to make sure that we're accurately tracking when you're logging in, bookmark this page, and that way, whenever we send out correspondence, you guys will get that email with any updates that happen. Drag this out the way. There we go. Okay, so the PASRR system is designed to work with Chrome and Edge. We can't guarantee it'll work with anything else. If you're having issues logging in, we do have some steps you can check. Password resets are usually governed by your IT, since the PASRR system is using Microsoft Azure, which means you're using your Microsoft account to log in, which means your IT probably doesn't allow you to reset your own Microsoft password. If they do, that's fantastic. That's one less hurdle you have to go through. For the MFA, like I said, that text, phone call, Microsoft Authenticator, whatever you have set up, if you need to change that, let's say you're getting a new phone number, you're using your work phone to get the text. If you can change it before you get the new number, that helps a lot. Otherwise, you're gonna kind of lock yourself out. If you need to get in and you can't access the old number, you can always reach out to IT Service Desk, let us know you need an MFA reset, and we can reset it for you. And you can also in your profile set up multiple MFA methods. Um, Simply on this page, go to your profile at the top, go to view account, and it might take a second. It might ask me to log in. If it does, I won't put you all through that torture. Okay, there we go. Go to update security info, and on that page is your MFA methods. You can add additional numbers, additional methods, so that way if one of them fails, you can maybe have a backup. Clearing the cache. Now, I mentioned when we have the system updates, we let you guys know. We also tell everybody in those emails to clear their cache after a PASRR system change. And that's because the cache is kind of like your browser's way of remembering how you interacted with the web page last time. And it kind of is a shortcut for navigating through the page. Now, if the system changes enough, that cache will mess up how you interact with the page in the future. So if we tell you guys to clear your cache in the email, please do, or else you might have issues when you log in next time. And then again, we give everybody IT Service Desk information at the bottom, just in case all the troubleshooting steps don't work. The training page. This is the important one for you guys, I think. The event schedule has training dates for the facilities. You all are welcome to join those if you want. The same material, though, is covered in these videos. We've broken down all of our training materials in a few videos. We're going to have one more video up soon on the new level 1 screening. But staff can watch these videos at any time to understand how to log into the system. Now, this is all from the perspective of the facility. But the dashboard, the user list, level 1 case list, level 2 evaluation, file exchange, all the processes the SNFs need to know, the hospitals need to know, are covered in these videos. We also have a couple of PDF documents for them. If staff are logging in for the first time, the Azure registration manual walks them through how to set up their account for the first time. The online system user guide and the level 1 screening guide are PDFs on the system and the level 1 screening specifically. Scrolling back down, the reconsideration page just goes over how to do the reconsideration in the system. We give them a link to the portal, and then we give them the step-by-step instructions. And if for some reason the system's down or the facility can't submit a reconsideration online, we do give them a download and they can send in that reconsideration form. But we always tell the facilities if the system's working and they submit a reconsideration that way, meaning via the form that they can send in, then we're just going to ask them to do it online. The FAQs. So this is where we have the definition for significant change. I believe it's here. Yes, so this is the old definition. This is where we're going to update it with the new text that we provided in the chat and on screen. This is the best place for the facilities to get any questions answered. We have a bunch of main categories, and as you can see, the subcategories. We tell them, try and find the subject that you're looking for. So one that we get a lot is the exempt hospital discharge. So we tell them to click on the main link. Instead of scrolling through the page, Control F, start typing in your keyword, and then that way they can get directly to where they're going. Just use the arrows to skip through the page, and then here's the definition for the EHD. We explain the 30 days, we explain the additional 10 days to get it done, all of that. And then last but certainly not least, The information notices. So these are all of the policy changes that we've implemented. The latest one that we did is the level 1 changes. So the changes to the level 1 screening. As mentioned before, the level 1 was changed to cut down on false positives. So the whole point of the PASSR process is to identify anybody with a serious mental illness that can benefit from specialized services in the skilled nursing facility setting. And the issue we had was our screening was being misinterpreted, and we had a lot of screenings that were positive when they didn't need to be. As a result, it was wasting our contractors' time because they would look into things, find out the person doesn't need an evaluation, and close the case. So we've added 2 questions, functional limitations and recent treatment. These are 2 criteria in the definition for serious mental illness to help identify if the mental illness that they're listing is serious or not. By doing that, we've cut down on our false positives a lot, and this allows our contractor more time to work on the individuals that have been identified positive and do need evaluation and, get their determination. So you can take a look at that here and any other information notice we have. The cheat sheet is also a good one. This one was made for the facilities to help them identify what resolutions are okay for admission, some examples of resolutions that are not okay. We have visuals and explanations of what everything mean. So for the hospital, exempt hospital discharge, this is a screenshot from the letter. So we kind of outline or highlight some of the areas that they can focus on. For the categorical determination report or the categorical letter, we highlight on that table where they need to focus on to see what needs to be done. And like I said, we break down what everything means under the descriptions here. So that's a good one to take a look at. Really, all of the information notices are a good read. But that is basically it for the web page. So some areas you guys might want to focus on are, like I said, the training page, FAQs, and information notice. Everything else, they're important, but you guys probably don't need to focus on those right now. Are there any other questions? Okay, I think we're good. I'm going to stop the recording.